This episode of the Birth Journeys podcast is sponsored by The Book of Hormones by Dr. Shweta Patel. It's available for purchase now on Amazon.com. See the link in the show notes. Hello! Today I have with me Dr. Shweta Patel. Dr. Patel is an OBGYN and a women's health expert. She created GaiaWellness.com, where women can meet with their women's health physician online. Dr. Patel provides comprehensive women's health care online to women in Florida, North Carolina, Virginia, Indiana, Tennessee, and expanding to South Carolina, New York, and Georgia, with plans to expand nationwide. And she also offers the Gaia Wellness Forum on Facebook, which is open to anyone who has ever identified as a woman and who is interested in contributing to women's health concerns. Today, we're going to be discussing her new book, The Book of Hormones, which covers women's hormones from puberty to menopause and beyond. Dr. Patel, welcome back, and thank you for joining me. I forgot to mention we're going to be focusing on progesterone. Deep dive into progesterone. I love it. Estrogen gets all the credit.
It's so not it. Yeah. It's
Let's make progesterone happen.
Yeah. Okay, if we were to rank them like in the Olympics, it would be progesterone would be gold, estrogen would be silver, and what's the other one? Bronze would be testosterone.
Okay, I was going to say, I don't know, oxytocin or...
Oh, no. Okay. You had to go there. Okay,
I'm sorry.
Yeah. Yes. For sure is like important in pregnancy, but it's like there in certain times. Whereas progesterone is like there all the time. It's like a helicopter mom or something. It's like fully loaded and needed, has to be there. Even the smallest changes and we're going to notice. Estrogen is there as well, more like part-time. And then testosterone and oxytocin is like the vacation hormone. Like it comes in for a really brief period of time, but does a really big job. And then testosterone is probably like the Zoom calls. It's not really there, but it's not there.
It's like virtual. It's the virtual hormone.
It's a virtual hormone. It says so much about our libido, huh?
Right.
It's
my goodness.
There. My sex drive.
There. Yeah. Yeah. Totally. Okay. So I'm thinking just because my listeners mostly either preparing for pregnancy, pregnant currently, or postpartum and trying to just kind of manage all of that. How does progesterone play into that whole process?
It actually plays into every phase of that. Without the effects of progesterone, we wouldn't be able to get pregnant. We wouldn't be able to go from the first date, as I call it in my book, which is where like the egg and the sperm meet and they have their little...
Hopefully it's not the first date when that happens, but okay, yeah, sure with that.
Judgy Wudgy was a bear. I was speaking anatomically, chronologically, definitely not socially.
Okay. But if that's how it happens, roll with it.
That is exactly how it happens. I think they even made a movie about it and Katherine Hagel was in it. And
they did, yeah.
But so outside of fertilization, when the fertilized egg actually comes into the world of the womb, there would be no world of the womb without progesterone, which is why that period of time between fertilization and implantation is where most women, A, don't know they're pregnant because nothing is seemingly different from the outside, and B, the follicle, or what I like to call like the nest from which this egg hatched, is very rapidly taking on the production of progesterone to sustain this fertilized egg until a placenta can develop. So it's almost like a passing the baton. And if that small window of time where the baton is dropped, the whole game's over. And so the structure that I'm talking about is called the corpus luteum. It's literally the bruised up, dinged up cyst that we have that released the egg. It's like it went through labor itself, right? And now the egg's like trying to make its way down and everything's fine and it's loving its new home because it's been made nice and plush by this corpus luteum because of progesterone. So without progesterone, there would be no nice little down comforter in the womb for this egg to snuggle into. And then as soon as maybe about week 5 to 8 kicks in, that's when the placenta is actually like in existence, but still like a weakling. It's not really doing its full potential, but that's also all progesterone. Like the whole point of the placenta is, amongst other things, but it's progesterone production. So when there's not enough progesterone, because either the corpus luteum was straggling along or because the placenta was like, I can't even, those are the times where you see those early pregnancy losses. Sometimes they're so early that a woman doesn't even realize she was pregnant, or it's what they call like a chemical pregnancy. It doesn't change the fact that if you were pregnant and if you knew about it and if you're trying, it sucks. But it's that one hormone, amongst other potential causes, but that one hormone is so critical that is how quickly it can go the other direction if it's not there in sufficient amount. And then once the placenta is established, it fully takes over production of progesterone. Estrogen's there. The ovaries are producing estrogen. So we obviously are still a woman. We still have estrogen circulating in our blood. We don't become anhormonic.
Okay. Anharmonic. I like it.
I'm not anharmonic. Are you? Is that what they call a menopausal woman?
I have no idea.
I just came up with it.
I
Don't
love it.
use
I think you
that.
should coin it.
Should have put it in.
People are going to go to their doctors and start saying, am I anharmonic yet? What?
I don't know. Can you sing me a song? I'll tell you.
Yeah. Sounds like tone deaf.
But cuter.
Yeah.
Right? Yeah.
Adorably tone deaf.
There's another term I really liked. I like using now is cuterus. Like I can't stop.
I love that. Yes.
Right? It's just so stupid, but it's cute. My cuterus is hurting.
We have stickers. I actually have a cuterus down here somewhere.
Yeah. I bet you do.
I do.
I don't want
to. I'm not going to dig for it right now.
Girl.
No, it's a plushie. No, here.
Oh, because you were looking down and you're like,
where do you keep your uterus?
Yeah. Oh my God. Look at those beady black eyes.
I know.
Yeah,
for those of you that are listening, this is actually may not be an actual cuterus. That is a brand, I believe. This is a uterus from Giant Microbes.
That's very cute.
The ovaries, and help me. I guess these are the eggs that detach, but I'm trying to make an anatomical sense of this because, why do they detach? Are they not the ovaries? No, they're not the ovaries.
They are.
But why do they detach?
Because the ovaries aren't attached to the fallopian tubes.
Oh.
They're attached to almost like...
I knew that, but why?
Floating. I don't know.
Why do they dangle?
I don't know either.
That's where I was like, what?
Maybe...
That dangly ovaries here. Maybe these are the ligaments. I don't know.
No, because the ligaments come from the uterus.
Well, then this is just
so
dumb.
It's anatomically
incorrect, but still cute. Yeah. Still a cuterus.
Super cute. Still cute. Yeah.
Yes.
I kind of like it. It looks like one of those mittens you wear, where they dangle.
Yes.
Yeah. That's why it's cute.
We were talking about the cuterus.
Thank you. So if the placenta doesn't start making enough of progesterone, after you're well into your second, after you're done with your first trimester and the placenta is really supposed to be doing all of it on its own at this point, that's when you start becoming at risk for preterm labor. And it's part of the reason why we prescribe women progesterone in pregnancy if they're at risk, either because they've had a preterm delivery in the past or if they are showing signs that they might be at risk for it in this pregnancy, which is usually their cervix starts to become very thin. And it's shown with enough statistical data to back it up that it's worth trying to prolong pregnancy that's at risk for preterm labor.
Okay. So it's the progesterone that keeps the cervix from thinning.
Melting.
And then the progesterone comes from the placenta. And then, so if you have a healthy placenta so is it, okay, I'm thinking chicken or egg.
That's a great question.
So where does the progesterone initiate from? Or does your body signal, how does that work?
We have our own progesterone that is produced from our ovaries, but specifically the part of our ovary that hatches the egg.
Okay.
Now, when we are not pregnant, i.e. that egg waits and gets ghosted or gets stood up and nothing happens, our ovaries' progesterone production drops because the part that's hatched the egg doesn't get the memo hey, they really hit it off. You're such a great matchmaker. Oh my God. Totes, great job. So the corpus luteum cyst starts to shrivel up and die. And this happens every month. Don't worry. Nobody gets sad. We have millions of those potential corpus lutei. But
I believe that is the plural. So
yeah,
you just it just sounds
I think
funny.
we established that grammar was not an issue in this.
No, we're not. We're not the grammar police here.
No, we're not the anatomically correct police.
We are not.
The part where if we don't get the egg fertilized, then we have a period. It's because of progesterone. Crazy.
How
So
does
we have a period
do so many things?
I know. It's just one of those really modest, unsung heroes for real. Because everyone's always talking about testosterone. Estrogen is always, oh my God, Venus. Oh, your boobs and like your hair and there's a glow around you. Yay. It also causes blood clots and stroke, but nobody talks about that. And what's the name of that geezer that just goes off? Old Faithful?
Old Faithful.
Yeah. Like it's there. It's always there. It does a great job reliably. That's what progesterone is. It helps us get to pregnancy. If we don't get to pregnancy, our period happens as a result of the lack of progesterone. If we get pregnant, then it helps keep the pregnancy going, as in we have our own progesterone production from our ovary that sustains the egg until the placenta is grown enough to make its own progesterone. And that's when you start throwing up.
Rude. It's the mom hormone. The mom's like manages the whole, all right, this person needs to go here. This person needs to go here. We're going to soccer in this car. And then we're going to this birthday party. That's progesterone. It's the mom hormone.
HCG is the part also that makes you, that's like actually what causes you to throw up. But it's like the placenta, when it takes over and just goes through and everything starts going on auto drive. That combination of sudden exponential increase in our hormones is when you're hugging the toilet.
That's so fun.
So amazing.
Speaking of which, I failed to mention that I also have a placenta here.
Stop it. Now that actually just looks like lips smoking a bent up cigarette.
It really does. Okay, so keeps you pregnant, makes you throw up, which also keeps you pregnant. What about after pregnancy? Because I remember learning that we get the progesterone only pill or a low estrogen pill when you're breastfeeding. What's going on there?
When you are in the immediate postpartum period, your body is still, though it should have most of its mammary production situated, its mammary situation situated. I'm sure that there are women who are listening who've experienced that delay where they're struggling and they're not producing milk yet, and it almost feels like it's not going to happen. And so there is that window where the impact of your hormones can actually be negative if you are taking estrogen in particular. Because too high estrogen levels can actually give the opposite message to your breast tissue. And without getting too technical, it would dampen the production of breast tissue and milk production. So for the first few weeks, a woman shouldn't really be taking any kind of estrogen-based birth control or should only take progesterone-only birth control. Now, really, a woman in the first few weeks after a pregnancy shouldn't be needing any birth control.
Leave her alone.
Right.
Let her heal.
Literally. Let her heal. Let the woman heal. Let both of them heal. But of course, that's also not always a guarantee. We do, especially if there is someone who's at risk for unplanned pregnancy, or because there are risks associated with that too. Having a pregnancy too soon after being pregnant, health risks to mom and to baby. And so there is a benefit of ensuring that no pregnancy occurs in that time period. But ideally, we can ensure that without any hormones. However, if we're going to start a mom on something, then either the low dose estrogen combination pills, like low estrogen, usually around 4 weeks onwards, or if it's something like you need to be started on something immediately, then a progesterone only option, because that will not interfere with breast milk production.
That clears it up. The thing that I was thinking though, my brain was going to when you talked about that delay of breast milk production, And I hear my patients ask me a lot, especially the ones that had a C-section, especially if it was like a planned C-section. They're worried that their breast milk isn't going to come in. Is that related to progesterone or is that just a myth?
I think that when there isn't that natural progression of oxytocin that results in labor, no hormone is an island.
Yeah.
Literally, like you can't say, oh, there's no impact on that to that. No, I'm pretty sure there is. We just don't care about it because it's not significant. So we typically say that the fact is some women will start lactating even while they are pregnant. And so you don't need to have the labor experience in order to stimulate lactation. So I don't think that C-sections, or especially like the scheduled C-section where there's no exposure to labor, has a significant impact, but I don't think that it has none. And I think that ultimately the biggest thing that impacts oxytocin levels outside of labor is bonding, which is why a woman continues to produce oxytocin and continues to also then generate prolactin, which is like symbiotically, ooh, oxytocin, ooh, prolactin, ooh, prolactin, ooh, oxytocin. Oh my God. That synergistic reaction makes sense because it's like, okay, you see baby, you start lactating. Okay, you start lactating, baby sees you. And so that makes sense, but I don't think it's dependent on it or is the only way to get to that equation, I guess.
Yeah. I would agree. And it's all about risk benefits. Right. There's always going to be some sort of impact on something when you make a choice to do anything. So
absolutely. Even we're not on an island. A woman
no one's on an island.
Section, except for the people that are on an island.
But
those
they're together on an island.
They're enjoying their life right now on it.
Let's go to an island.
Yeah,
talking about
sounds amazing.
My oxytocin levels will go up.
Yes. Which is the other thing. It's like oxytocin levels go up all the time. Even like when we are interacting with our children that are walking around no longer breastfeeding. So the impact of oxytocin on breast tissue is also very time dependent. So it's not going back to does it have an impact on breast milk production if you have a C-section because you're not exposed to as much pitocin or oxytocin. I don't think it's a critical one.
Yeah, there's lots of impact. The stress hormone probably does something too.
Yeah. You're not being sliced open or anything.
Right. Or you didn't just have a really long labor and opt for a C-section. You're not stressed out.
No.
There's a lot more to it. Okay, so we were talking about birth control options and how progesterone plays into that and the options with different doses of progesterone. Can you weigh in on that and explain that a little bit?
So the different options are, there's a pill, there is the injectable called Depo-Provera, there is the implant, which is Nexplanon, and then there's the IUD, which is like the Mirena, the Skyla, the Kylena, etc. All these cool names. It sounds like Kardashian sisters, but it's not. So the cool thing about the pill is that, well, it's a pill. You don't have to get a shot or have an implant put into you. And it's progesterone only, also cool, in the setting of not wanting to take something with estrogen in it. The caveat with the progesterone only pill is it's low dose of progesterone. And the reason why that's important is because on its own, not the most reliable contraceptive. In conjunction with breastfeeding, it is less likely to fail when done in conjunction with breastfeeding. And that's because the dose is low enough. It's not like when you get the shot where you're getting a 3-month supply up front hanging around in the fatty tissue of your arm or thigh. This is a daily dose that needs to be taken, and even a slight variation in the timing of when you take it can impact its bioavailability, meaning like it wears off. So if you don't replenish it right when it's wearing off, you're creating windows of opportunity for failure. This is great, right?
So fun. Yeah.
Whoa, why would a woman who's sleep deprived with a child and leaking out of her boobs accidentally forget to take her pill on time?
Can't imagine.
That's so silly.
Nothing else going on.
No. For all the other more perfectly ideal scenarios, it's a great option as long as you don't have changes in your weight, changes in your body temperature, changes in what else you're taking with it, like other medications that could impact its absorption into the bloodstream, first pass effect, as well as the time. So just changes in when you take it. Yeah, it works great.
All those variables.
And changes in your breast milk, like in your stimulation, because the other part of the reason why, and this is again a hit or miss in my opinion, but a lot of women think that breastfeeding is an actual contraceptive method. They're not wrong. It does have a suppressive effect on ovulation, but there's no formula for exactly how long somebody has to be on the boob and for how often and what's considered effective. So good luck with that. That's why on its own, it's not technically considered a satisfactory contraceptive method. But when you combine the two, they're perfectly imperfect together. And so it's considered to be a better option. Now, if you'd like something a little bit more reliable, then yeah, the options of Depo-Provera shot, which is notorious for weight gain, but does work in preventing pregnancy, also notorious for causing erratic and annoying bleeding, which is great because you're already having that. So why not some more? And you can't take it for more than 2 years consecutively because it does have the effect of making your body kind of estrogen poor, which then affects your bones. And I do know women who take like Depo shots every 3 months for years and years because they were never counseled about the impact it can have on your bone density. And so it's definitely be cautious. It's a great solution for a limited window of time, but you don't want to be using that as like your long-term method of contraception.
Yeah.
Or the IUD, which in my opinion is the OG. Right? You can get it placed. Some places still offer to place it right after delivery. The failure or the propulsion rate was high enough where we stopped doing it back at the military. But you can get it as early as whenever. And it's good for anywhere from 3 to 7 years. Makes your bleeding lighter. Doesn't make you gain weight. Doesn't make you go crazy. If those things are happening, they're happening on their own.
That's why I love it.
Yeah, you got one too, huh? Hey, Maria.
Yeah. No more babies for me.
Nope. You know what the best part is? You get an entire election cycle.
Yes.
Yeah.
Yes. FYI, run, don't walk.
Yeah.
Go get your IUD placed right now.
Yes. Yeah, I said that in my book. I'm like, I have the Mirena and it almost gets me through 2 election cycles. It's amazing. If I wanted to stretch it, I could get to 2.
Yeah. Now it's making me, oh no, I got mine about a year ago. Okay, I'm good. I'm good for,
yeah.
You have some exciting options for postpartum hormonal regulation and mood regulation, which is fascinating to me. Tell us more about that.
I think going back to like what's up with progesterone, is it important? The placenta shearing and coming out, it is like a nosedive in our progesterone levels. And the sad part is all we're doing is coming back to pre-pregnancy levels, but that is like going from being on the first class flight and then traveling on Greyhound.
I was going to say in the luggage compartment, but Greyhound sounds better.
We're not even by air anymore.
We're not in the air anymore.
No.
So we're in the luggage compartment of the Greyhound, essentially. We're like the worst of the worst.
That's harsh, but yeah, sure. And you think it's like we were fine with it before, right? So it's not that we're deficient in the hormone. It's that drastic change that causes us to act all sorts of the ways, right? Including to some level, sometimes even postpartum psychosis. It's because of that drastic drop. If we were to take the drop that we experience immediately after delivery and spread it out over a month, everybody would be fine. But since we spread it out over like an hour, it creates some real shit. Yeah. And we really depend on oxytocin at that time.
Yes. It's amazing though
like,
how
talk
it
about
really functions. Like
it's
you're like
up.
well, ooey gooey with your baby and completely
like,
ignoring
I don't care
the fact
that
you were being put back together however you delivered.
My brain don't work. My brain broke. Literally. But it's true. It is. My brain broke. It's like, why would Mother Nature think it's a good idea to break our brain right after birthing a child? like
because all you have to do is cuddle that child or run and then
cuddle that child,
depending on what
right?
the
No,
emergency.
because Mother Nature was banking on some solid alpha males that are like
Mhm.
protecting and providing,
Yes,
and was not
yes.
currently thinking about 2025,
Mm-mm.
right? I'm just saying.
Right.
But
Yeah.
I think the logic is no, your job now is to just keep warmth and be a food source. And everything else will be brought to you, right? Like food and protection, except we have to like get back to the other children or go work and
Mhm.
or just figure out how to put the circuit breaker back on or something. Like life
Mhm.
still goes on and we have to still use our brain while it's broken. And I say that in jest, but what I mean when I say our brain breaks is progesterone, though it usually only gets like the street cred for being like, hey, what's going on, guys? I'm here to reboot your uterus and then help the pregnancy feel nice and cuddly. You like my progesterone voice?
Pretty
It
good.
actually, thank you. It's like such a basic, like unremarkable voice, right? Yeah. So, but progesterone actually is a precursor to a neurotransmitter in our brain.
Wow.
Yeah, it's like a little stuff. Oh, no big. Just kind of like a big deal with the GABA receptors in our brain. You know, the ones that
Right.
like dopamine, like
Mhm.
you tickle those kinds of receptors.
Mhm.
Yeah. So
Super important.
a little bit, yeah. And we can't make that neurotransmitter from any other way. It's progesterone or it's nothing. And so what happens is it's nothing. We're stuck with maybe what is it? Serotonin, norepinephrine, epinephrine, dopamine, and then that fifth one. And so we're just dealing with 4 out of the 5 that we normally have.
Mhm.
So just a 20% drop in cognitive functioning. Not big.
Nothing. No big deal.
Yeah.
Okay, so we talked about that huge
Drop.
hormonal letdown. Yes,
Yeah.
after
Letdown.
delivery. And then it stays at your pre-pregnancy level, but then everything else in your system has to like figure out how to live life again at that pre-pregnancy level. And so then since it's a precursor to neurotransmitters that are important for mood and like all of the things, mood and thinking, we'll just generalize it. It's a precursor to brain function. How about that? So, are we shocked now that moms have a lot of challenge often?
I'm shocked that they function.
Let's flip that mindset around and be like, hey, mom, congratulations to you if you're still breathing after all this happened.
Yeah. Like, do you remember that it's front to back?
Yeah.
You do. You are an you're an ace.
Yes.
'Cause I would have forgot. I would have forgot. With what you're working with, I would have forgot.
Uh-huh.
I would have been like,
Yes.
"What do I do with this?"
Exactly. Yes. And then we add on this entirely new experience of you're basically becoming a whole new person. You have to figure out who you are with all of this new body and the new everything and then the new baby and then all the things are working differently and nothing looks the same, nothing feels the same, and I can't brain the same. But carry on, everything's fine.
Yeah, you should be so happy.
When are you ready to go back to work?
6 weeks.
Yeah, exactly.
Yeah.
It's no wonder that moms are feeling a little overwhelmed and they can't always do it. I don't know how else to put that. But let's manage expectations. What is going on with society where moms just have to like do it alone?
Yeah. Or how about when a woman is back to work and struggling,
Mm-hmm.
and it's like, gosh, all she's thinking about nowadays is like being a mom.
Yeah. Yeah.
No fucking shit, Sherlock.
What else is there to think about? There's no brain work
here. Like,
yeah, exactly. Yes.
And that's not to say like for women who want to go back to work, great. Again,
if you're feeling it, go for it.
I'd be stuck at front to back. That's where I would be stuck at. So if you're,
I would get breathe in and breathe out.
Yeah, like I was seriously just giving myself UTIs all day long because I'd be
Yes.
like, right? I tried making myself coffee the other day after I had a really busy shift and I drove home. And I think I put the bottle of creamer in the microwave.
Oh.
I couldn't get to the point of making my coffee because the creamer was gone.
That sounds really fun and confusing.
Yeah, it's like a chicken and the egg about my coffee.
Yeah, exactly. What do I do? How do I coffee this morning?
Right. Yeah.
I remember coming home and from a shift while I was like, I don't know, like 8 months pregnant. I had my lunch bag. I had my purse. It was winter, so a coat and my keys. Oh, and my phone somewhere. So there was a pocket in the side of my lunch bag. And so I just dropped my keys and my phone in there. And I walked inside, and my daughter came up and gave me a hug, and my in-laws were in town. There was just a lot going on. And because I had not finished eating my lunch, because, I'm a nurse and rarely does that happen, I put my lunch bag in the fridge because I didn't want anything that was left over to spoil, because then I was going to take out the bad stuff and the good stuff was going to stay for the next day. And I couldn't find my phone or my keys. I was so confused. I had the whole family looking for them. And of course, I found them in the fridge. And can I tell you the flack that I got from my husband when he's like, "Why are your phone and your keys in the fridge?" I was like, "It makes perfect sense."
Yeah,
it makes
that
perfect.
Makes 100% perfect sense.
If you know the backstory, my hands were full. That's why.
Your battery was running low, so you
also
pulled your phone to use up less power.
I used my brain, what little brain I had left, to put my phone and keys in a safe place so that I could get inside the door, and then I was done. I had used.
Why don't we talk about how you guys failed me? How about that?
Right.
Let's talk about that.
Yes. Why didn't you guys know logically that I put my keys and my phone in my bag and put it in the fridge? Duh. But I found it later when I went to go make my lunch. Which
I bet you those are a cold phone.
It was somewhat chilly. It was somewhat chilly, but it wasn't much long after, so it was fine. Essentially.
Yeah. Cold calls. So the whole point of the brain break is to demonstrate the value of progesterone, not just on its own, like that. Oh yeah, that's why things are as challenging as we don't let them seem they are, but also because one of the treatments that are currently out there, and granted it's a very expensive treatment, so it's reserved for severe refractory cases of postpartum depression and or psychosis, which I think it's just unfortunate. I don't think it's always going to be the case. I think somebody's going to come up with a compounded version one day, and hopefully we'll all just get to live a better life. But until then, you have to really wait to lose your shit before you can have it. But all it is a synthetic version of the neurotransmitter that we create from progesterone, allopregnanolone.
Ah, there it is.
Duh.
I think I remember. Okay, so is zuranolone also? Because there is a new medication that came out for severe postpartum depression.
Are we talking about the same one?
Maybe.
Still Resto?
Maybe. Zuranolone, what is it? Yes. Zuranolone is a synthetic form of allopregnanolone. It's the only oral. Yeah, that came out a year or two ago. And it's a 14-day treatment. So we've got the really expensive, I'm sure they're all expensive right now, but like the really expensive IV version. And then it appears that now there's an oral treatment, and we have no idea how much it costs. But the point is, this is for really severe postpartum depression.
Which is one of those things where I'm like, okay, it's severe if you have postpartum depression. But a qualifier like that in my world is like a slippery slope, because you're already dealing with a woman who's prone to guilt complex and prone to I'm failing in motherhood. And so when you try to quantify whether their symptoms are severe or not, I feel like there's more women that will fall through the cracks.
That's true. Yeah. I guess a better way to say it is the intractable. Like, we've tried other medication. Now, I mean, at any point, are we hoping that this becomes the new medication? Like the first?
I think it has so much to do with everything else. Like, I think it has to do with your insurance and your doctor addressing it, and then your willingness to be on a treatment that is effective, because we tend to like to beat around the bush when it comes to doing things that work, right? Yeah. Everyone's like, isn't there something else I can try first? Again, because it comes with that taboo of, oh, you're failing at what you should be doing naturally, which is obviously already hair done, makeup on, wearing high heels, and baking dinner for everybody while the baby is still out hanging off of one boob.
Yeah.
And good luck.
So if it's the precursor for the neurotransmitters that balance your mood, I guess it just depends on what end you want to attack the problem at. Do you want to start at the source, or do you want to?
Yes. The way antidepressants work is that they slow down
The reuptake,
recycling.
right?
Yes, our recycling of our neurotransmitters. And that sounds like, oh, why would you want to not recycle your neurotransmitters? Don't you want to keep using it? And it's no, but the quicker we clear it out of our system, in our brain system, that's more opportunity to go without it. So it's like there's blood in the water and you're clearing it out, right? Like we know we want it to linger. We want the fishies to come. So antidepressants like Paxil or Wellbutrin and or Zoloft, these are your garden variety, Costco grade antidepressants that everyone's familiar with. The way they work is they're not giving you the actual neurotransmitter that you are either deficient in or going through too quickly. They are blocking the hungry hippoing of that neurotransmitter.
The hungry hippoing of neurotransmitters. You heard it here, folks.
Yeah, and only here, along with anharmonic.
Yes. I think there's another one in there somewhere too.
There's so many. We want those white little balls to stick around in the playing field for the hippos.
Right.
And so, whereas treatments like Zulresso or the synthetic version of allopregnanolone is that they actually give you the neurotransmitter that you are deficient in, so that it then allows for more balls to be there, not because the hippos have stopped moving, but because there are more balls. And the hippos are like, whoa, we're full, but this is great, except they're not full in a postpartum woman.
Yeah. So essentially, if you take the reuptake inhibitors, the traditional medications that block the neurotransmitters from being recycled, and that's not working, maybe it's because there's not enough neurotransmitters to recycle to begin with. That's where the problem could be the sudden decrease in progesterone. So then we maybe put back the progesterone, which is the precursor to those neurotransmitters we liked. And then now we can actually have functional reuptake inhibition or functional recycling of the neurotransmitters, like to the speed and level that we would be able to maintain a mood that feels doable.
Right. Right. I guess the best way to put it would be like in terms of motherhood. If your kids are hungry and there isn't enough food in the house, you don't tell them to become less hungry.
Yeah. You just give them enough food to eat. If there's not enough food, they're going to be hungry.
Correct. Yeah. But the treatment wouldn't be like just give them Benadryl so they go to bed hungry. That would be treating a woman with an antidepressant. Again, it works for the short term.
If there's enough neurotransmitters to make it work.
But that is why, and that's why not everybody is being treated with this drug who's not postpartum. Because that's a great idea. Why doesn't everybody get more neurotransmitter? And that's not the point. The point is there's a very specific cause for this depletion. And so we're actually addressing the root cause there. Or dare I say for once.
Yes. And this kind of ties into this common argument that people will liken it to. If you were lacking insulin in your body, would you replace it in order to stay alive? Insulin is also technically a hormone. Am I?
Yes. Oh, it's like you read my book.
Right. So if we're just balancing the progesterone because there's a sudden deficiency and the balance is off after a natural process leading to signs and symptoms of depression, which is just basically a neurotransmitter imbalance, then why so much stigma around postpartum depression?
Oh my God. Why not? Because we can.
Right.
Give us an opportunity to feel bad about ourselves. And girl, you know we're going to.
Yes.
I'm bringing my lawn chair.
Yeah, exactly. So maybe we can reframe this whole postpartum depression thing and just help people balance their hormones. That'd be great.
Yeah. I would love it if we saw this as like the way we see taking our prenatal vitamins afterwards. You know how we judge women when they don't take their prenatal vitamins after they deliver a baby? We're like, wow. Yeah. It's like you don't even care about yourself anymore. How are you going to get your iron back? You're still you're still producing for two. Okay.
Right.
Well, right.
Keep eating.
So that was
It's
my
hard.
judgy cis voice.
Uh-huh.
So just like that, you're gonna take prenatal vitamins because
Mhm.
you know that you've lost a lot of stuff. God knows
Mhm.
all the stuff that you've lost, but you've lost a lot of
Mhm.
stuff, and you need to take your prenatal vitamins to help you while your body becomes to the point of being
Homeostatic.
balanced again. Thank you. We're back to
Every
where you
once in a while.
were, where nobody was trying to grow out of you or something.
Uh-huh. Yeah. You're not in a parasitic relationship anymore.
Yes. And then you're off on your own. Training wheels are off. Go ahead, girl.
Exactly.
But
Yes.
yeah, same thing, just like that. Blood, I don't know, neurotransmitter, same.
Right.
Iron,
Exactly.
all the important things. You know, we
Right.
don't have to wait for it to be such a big deal before,
Yeah.
you know, like,
Hey, you would give somebody blood if they had a postpartum hemorrhage. Why wouldn't you give them progesterone if they had a postpartum progesterone hemorrhage?
well, that's the problem.
Or maybe you did with the blood leaving your
I
body.
think one day, maybe in the far away, we
Mhm.
will start giving everybody these kinds of treatments preemptively. Just like right
Mhm.
now, some people think, oh my God, why are you giving me Pitocin?
Mhm.
Do I
So you
need
don't
it?
hemorrhage.
Oh, I love that question. And it's no, you don't need it yet. Your body used to do this on its own when we lived in the jungle.
Mhm.
But since we don't live in the jungle and don't forage for our own food and do have things like obesity and high blood pressure and all these other medications that we take, and our body has become used to not doing what it's supposed to do, we have to help you out a little by making sure you don't bleed because we don't want you to need a transfusion. And the same
So
goes for
let's
a feel-good hormone called progesterone, apparently.
Yeah, that'd be really lovely if we had all of those options just available.
Yeah.
Wouldn't it be wonderful to be able to, like, when you do the postpartum CBC, could you do like a postpartum progesterone level and just like see where we're at and baseline, or maybe what, I don't know, postpartum oxytocin level and just figure out like how to, maybe we could just rebalance everything?
Yeah.
Too hard.
Right? I think that how much of it would be the validity of those things and the utility of those things versus the need for them are whole
Mhm.
three different ballgames, right? So I'm sure that if we were to live in an isolated environment where we had unlimited resources and we can just sit there, you and I, and be like these mad scientists that just
Mhm.
tested everything, and we're looking at a woman's levels of iron and estrogen and progesterone and oxytocin, heck, even testosterone, just to be like, okay, see, that's why she doesn't want to have sex, guys. Leave her alone.
They'd be fixing the testosterone so fast if we did
Right?
that.
Oh my God. If
Maybe
there was
that'll
like
be the first one.
can you imagine? Let's come up with a finger stick testosterone test so that women can be like, sorry, honey. It's physiologically not possible right now.
Guys would be running out and buying testosterone for their wives.
Yeah. They'd be like, a
Why are you
little for
growing your
you,
facial
a
hair,
little for
honey?
me. A little for you, a little for me. Yeah. But I think that we don't have enough information to tell whether that would be effective or not. And
Mhm.
I don't think that the reason we don't have enough information is because it's not necessary. I don't think it's
Mhm.
I don't think that the reason we don't have enough information is because it's helpful. I think the reason we don't
Mm.
have enough information is because the costs don't necessarily justify the means.
Mhm.
And when you don't have data because it's too expensive to generate, then you don't have data to prove it on a level where it can become cost effective. So then the
Mhm.
whole
So then there's just no money. 'Cause I'm
then
Julie.
right, there's a self-fulfilling prophecy. Gosh,
Uh-huh.
I love
Yeah.
those.
Tell us what we're gonna learn in your book. This was just one conversation about one hormone.
I know, right? Crazy.
Right.
I'm a little less verbose on each topic, I promise.
Mm.
So you will not spend like an hour and a half understanding each hormone. But the tone and the informality is pretty much the same.
That's why you're here.
That's
You're like
I should have probably consulted with legal before I published this book because I don't even know if I'm allowed to say things the way I did, but I know I did. And honestly, as my firstborn, Mimi, my husky
Mhm.
chow mix, she passed away just about a little over a month ago. And
Mhm.
after that, I had even less fucks to give about what I said.
Yes. Yes.
So I'm sorry, you're going to have a lot of bleeps on your podcast, but
That's all right. No, it's
yeah,
I don't bleep. I just put explicit and then we're done.
good.
Yeah.
Oh,
I don't like
shit.
censoring.
Here I was holding back. My goodness.
I did.
You should have told me that before. So yeah, outside of that, and then a lot more explicit. Just kidding. They're not that many. In fact, they're actually not. I think of myself as like the Ted Lasso of OBGYNs.
Okay. I like that.
Yeah.
Making everybody play together as a team.
I was thinking more like just cheesy, but yes.
Okay. Also,
yeah.
amazing.
Yeah, there may be a dad joke in there or two.
Oh, that's okay. I like
Or
dad jokes.
70.
And then your next work in progress after you take a nap after this book.
Yes. Because my brain broke. No. I'm going to get some Zolresso. Oh my God. Zolresso.
We did Google how to say these things before we started recording.
But one of the tests to see if you need it is to see if you can say it. And so obviously, just kidding. Also, we're not getting any kind of kickbacks from any of these companies that we can't say names correctly of.
None of them.
Especially after that. So no, what you can expect from the book is that it's not going to be the PowerPoint of books on the topic at hand. It's more like going to be a transcription of a conversation you probably would have had with your girlfriend who happens to be a doctor. And that may or may not be a good thing because the conversation is very natural. And so it goes all over the place and somehow magically comes back to the point.
Kind of like this episode.
Yes. Like I said, it's this is the tempo.
Right.
And in the first book, the Book of Hormones, obviously there's so many other hormones in addition to progesterone, including ones you don't think of as hormones, like vitamin D. Booyah. And I don't mean the dick. The actual vitamin D, like sunshine. And so I try to keep it organized by how it affects women. So we do talk about menopause. We talk about puberty. So if you have a teen or a tween and don't want to have to reinvent the wheel on that conversation, there's that, as well as birth control, trying to get pregnant, becoming pregnant, as we talked about in this podcast episode. But then crazy thing is this topic of pregnancy is just so ginormous that it felt like a fire hydrant to the face when I was trying to incorporate it into something of an organized chapter that didn't go on forever, like me right now. And so I realized I'm like, this is ridiculous. I'm going to need to write a separate book. And so the chapter on pregnancy is as comprehensive as one can get without having written a separate book yet. And then, of course, there is other topics such as things that we don't necessarily associate with being just a woman, but it still affects us harder than it does men, like diabetes and your thyroid and guess what? Your adrenals and cortisol. And then there's an entire dedicated section to just straight up treatment protocols. So that, in other words, you can feel confident that you know the options and you are not just relying on a very busy, frazzled new graduate doctor who may be like running on short on time because they're busy seeing a bajillion patients. And though their heart's in the right place, they don't have the capacity to always cover everything. You can walk in there feeling empowered that you already have all the options you need to know about and have a more targeted discussion with your doctor. The goal is to make this a tool so that the doctor-patient relationship actually is improved. This is not like giving you what we don't want you to know. Like there's no such thing. We tell you everything if we had more time. Look at me. Give me an hour on a podcast.
I just want to tell you in a way that makes sense so that you get the actual information.
Right. Exactly. And so, yeah, and it literally does have dad jokes in it. Like some of them are authentically produced, like their original Shweta Patel dad jokes.
Oh, I love it.
Yeah. You want to hear one?
Yes.
Okay. Since you're insisting. Why did the ovary stop ovulating?
I don't know.
Just because.
Wait, what? Just because?
Just PCOS. PCOS.
Oh my God. I was thinking like P. Oh my gosh. There you are.
Hi. It's me. I'm a middle-aged dad stuck inside a middle-aged woman's body.
Oh my goodness.
That sounds gross. Not in that way.
That should be a movie. They have the mom and the kid,
parent
parent
swap.
or what is it called? 13 to 30 or something like that.
17 again with Zac
Something like-
Efron. And
Is that? I guess there's a lot of them. Yeah.
Matthew Perry. Oh, rest in peace. And then the next book will be everything on pregnancy, including some things I think that will be a little bit different from other books, but also combining different books together, which is like how to level up your experience in labor and delivery, down to including what to say and ask how to say it to nurses and doctors so that you get what you want. Birth plans.
Yeah. Love that.
All the things. Like,
are we going to keep calling them birth plans? Because they're not really a plan.
Birth goals.
I call them preferences or a birth vision.
Yeah.
So that it's like more
goals. Like goals. Hashtag birth goals. I don't know, my head's bobbing so much when I say it, but
don't either. Love it.
My Indian's coming out.
Oh. You're gonna go Bollywood on me right now. There you go. Yeah, you did.
Built-in bobble doll arrived.
I love it. Is there anything we didn't cover that you want to talk about?
So much, but not for this episode.
Not for this episode. We'll do it later. Okay.
Yeah.
Dr. Patel, as always, it has been quite a pleasure.
Thank you. Likewise.
And your book is now out. The Book of Hormones by Dr. Shweta Patel is now available.
Yeah, you can Google it. Preferably you go on Amazon because that's where it's published from. So if you're one of those folks that has Kindle Unlimited, where you have like that, it's included in your Prime membership or something, you can actually read the book for free.
Amazing.
The other way that it is available is paperback. Again, you just go on Amazon and put in the Book of Hormones. I don't think you can get a more straightforward name. And it's hard to miss the cover. It looks nothing like a medical book on hormones. It's a woman jumping for joy. There you go.
I love it.
Or you can also, if you want to scope it out before you buy it, you can also just go on the page on Amazon and look at the sample. It gives you the first 4 chapters for free.
Oh, wow.
I know. I was kind of like, WT. Like, what? I didn't know if I was happy or upset. I'm like, good thing it ended on a cliffhanger. Was
it the PCOS joke?
No, I gave that one ahead of time. That was a spoiler alert.
All right. When you want to hear the joke about PCOS or why did the ovaries start working or stop working? I'm messing it up. I'm not even
delivering.
It is. It really is. Okay. If you want to go read Dr. Patel's book, go to Amazon and get the Book of Hormones and start learning about your hormones, and stay tuned for the Book of Pregnancy or whatever that title's going to be.
Literally what it's called. The Book of Pregnancy.
The Book of Pregnancy.
I like to keep it pretty straight and narrow.
Yeah. Nobody's going to be confused about what it's about. Thank you as always.
Thank you for having me.